23 weeks pregnant, you probably have a lot of questions right now, like, how is your baby developing at this stage? What tests might your doctor order next? And what are they actually for? And how do you deal with common second trimester issues like back pain, hot flashes, and constipation? We're going to talk about all of that and more right now. But first, if you're new here, you're watching the Health and Medical Zone, and in the Health and Medical Zone, health means in good health and spirit. So if you like being healthy and happy, go ahead and click subscribe because you're in the right place. At 23 weeks, your baby's measurement from crown to rump, meaning from the top of the head to the bottom, is around 8 inches. If you measure from head to heel, that's roughly 11 inches, so almost the length of a 12-inch ruler. At this stage, your baby typically weighs around 1¼ pounds, and from this point forward, you're going to see them gain weight at a much faster pace than earlier in pregnancy. You're now more than halfway through, and your baby still has a lot of growing to do. Up until this point, they really haven't developed many fat cells, so their skin looks very wrinkly and saggy. But now, they're beginning to develop those fat cells, and they'll start to fill out and plump up. In fact, over the next 4 weeks, you can expect your baby to double in weight. Until now, your baby has looked somewhat purplish because their skin is so thin and transparent. But as those fat cells grow, their skin will become less transparent and start looking pinker. They're also getting more active. Kicks and punches are becoming stronger, and by now, you might even be able to see your baby move. If you lie down, stay very still, and pay close attention, you may notice those little movements. Your baby's lungs are still quite immature and won't be fully developed until around 37 weeks. But right now, they're practicing their breathing motions to prepare for their first breaths. When they do this, they're actually moving amniotic fluid in and out of their lungs. Meanwhile, the blood vessels in the lungs are developing, and soon, they'll begin producing something called surfactant, a vital substance that helps keep the air sacs in the lungs from collapsing when you exhale. Now, I talked about Braxton Hicks contractions in my 22-week video, but I want to take a minute to talk about preterm delivery. If a baby were to be delivered at 23 weeks, approximately 1/3 of those babies can survive. And out of that 1/3 who do survive, about 60% will have some type of severe disability because they were born so early. Of course, you absolutely don't want your baby arriving this early. But reaching 23 weeks is still considered a milestone, because if for some reason your baby were to come now, there is a very small chance they could survive and even be perfectly fine. But again, the goal is definitely to keep your baby cooking until they reach full term. As for you, you're well past the halfway mark. You're 5 months and 3 weeks along, with only 17 weeks to go. Your uterus is sitting about an inch above your belly button now. And at this point, if someone didn't already know you were pregnant, they could probably figure it out. You're officially sporting a cute baby bump. On average, by 23 weeks, most women have gained around 12 to 18 pounds. You're still in the second trimester, and for many of us, this is when we feel our very best. But there are definitely a few things you may be noticing that can start to slow you down. The extra weight you're carrying can really take a toll, especially on your hips and lower back. And this can leave you feeling pretty sore and achy. A good maternity belt can make a big difference and offer some much-needed support. Your center of gravity is also shifting, so take it easy and be extra mindful as you move around. You might also start to notice a lot of hot flashes now. You've got a bun in the oven, and that oven can make you feel hot all the time. If your second or third trimester falls in the winter, cooling down is easy. Open a window, wear lighter clothing, or lose a layer. But if it's summer, you just do whatever it takes to stay comfortable in the heat. And yes, absolutely no judgment. I highly recommend keeping a fan with you when you can. And if you're outdoors, the kind that sprays a light mist is even better. Wear comfortable, loose-fitting clothes and choose layers so you can remove something if you start burning up. One super cheap option that works wonders for hot flashes is a cooling towel. Just wet it, wring it out, drape it around your neck and shoulders, and it stays cool. It's honestly so refreshing. And remember, the thermostat exists for a reason. If you're overheated, go ahead and turn it down. And if anyone says, "Hey sweetheart, don't you think it might be a little cold in here?" Well then, that settles that. At your next prenatal appointment, your OB or midwife may order a blood sugar test to screen for gestational diabetes. This is a common condition during pregnancy and affects anywhere from about 2% to 10% of pregnant women. It's recommended that all pregnant women get screened between 24 and 28 weeks. Your OB or midwife may also order a blood test called a CBC, which stands for Complete Blood Count, to check for anemia and other issues. Anemia is pretty common during pregnancy, and that's why most prenatal vitamins include iron. But sometimes your OB may recommend taking an additional iron supplement if you need it. Just as a heads up, iron supplements can cause constipation, and honestly, even the iron in prenatal vitamins can do that. It definitely did for me. So if you're feeling a little backed up, try adding more fiber to your diet. Things like fruits, vegetables, kidney beans, quinoa, and oats. And if you're still dealing with constipation, over-the-counter options like Colace and Miralax are considered safe in pregnancy. But always check with your OB first to make sure they're okay with it. If this is your first time here and you haven't seen them yet, make sure you subscribe and then go check out the earlier pregnancy videos. There's a ton of helpful information in them, and I really recommend giving them a watch. Also, just a quick reminder, these videos are meant to be educational and informative. They're not intended to diagnose or treat anything. I strongly recommend continuing to attend all of your prenatal appointments and following the guidance of your own OB. You can actually press gently on your belly, and if your baby feels that pressure, they might kick or push right back. And sometimes when you're at your OB appointment, if they're listening for heart tones or doing an ultrasound, the baby might kick the ultrasound probe, and you might even see it happen on the screen. Thank you for watching.